And then to feel, either that your body's betrayed you or you're fighting cancer, but that cancer's inside your body. It changes the way you think of yourself and move through the world for sure. My name is Leslie Heron, and I am a nurse and nurse practitioner. And I did family practice for about 20 years before switching gears and doing cancer survivorship as a specialty. I would say that cancer affects intimacy, sexuality, relationships, body image, all of those things for everybody who goes through cancer. And that might be just a little bit, and that somebody just feels more fatigued, and therefore maybe their sex life suffers just because they don't have as much endurance and interest as they might have before. Or it might affect somebody very significantly in either the physical surgeries and chemotherapies and radiations have really changed the way their body feels or the way that they feel in their body, or that they just feel kind of overtouched and underloved and don't want anybody close to them. That's another thing. And I believe that that is the same for pretty much anybody. You can be in any relationship at all, in any self-identity at all, and still have to deal with your own body image and how cancer affects you. Talking about it, getting it out there, whether that's talking to yourself about it and acknowledging it, because I do think oftentimes we have worry and anxiety and anger and fear and all of those things. So I do think acknowledging it, and then getting it out there, talking, whether it's to your best friend or to your partner or to your healthcare provider, to say, like, I'm experiencing this and this is stressing me the heck out. What can I do about it? Because sometimes even just that steam release is changing. It's miraculous. It's like, oh, I've acknowledged this and I've spoken it out loud. Oh, that's better. Right? So there's that. So I would say that's my number one. Don't keep it to yourself. You're not the only one experiencing this. Everybody experiences this to some extent. And then the other thing is letting, my motto, let each time be its own time. So if you have a crappy conversation with your partner, that doesn't mean every conversation has to be crappy. If you try to make love and it doesn't go so well, maybe next time, after you've talked it out in a safe space and away from the bedroom, maybe then next time you can set some different expectations and things will seem better. Maybe this time was terrific and next time isn't so much. And it's like, it could be terrific again. So really letting each conversation and interaction with your own body or with a partner's body be its own time. Oh, what kind of question should you ask your provider? What a great question. I believe that probably an opening volley might be something like, I'm feeling whatever, let's imagine vaginal dryness. I'm having vaginal dryness. Is that common? Is that something you see? And kind of test out what kind of response you get. It's like, oh, look at the time, I've got to go. Um, maybe that's not the provider that you want to talk to this about. But if they say, like, oh, I hear that a lot, but I just tell people it'll get better over time. And then you can be like, okay, is there someone else you can refer me to? Or maybe you crack that ice and the person is like, oh my gosh, yes, let's talk about that. I've got some tips for you. So I think you've got to be able to just crack the ice and say, I'm experiencing this, or my partners and I are not communicating well. If you crack that ice, then you can figure out what happens next. I do really think that we need to just, as a society, as as cancer survivors, as healthcare people, all of this, talking about intimacy, communication, sexuality, relationships, acknowledging that this is an issue with cancer and survivorship across the board. And whether it feels like it's not a very big problem or a really big problem, if we can talk about it and get it out there and normalize it in the world, it really does happen to most people. And we should really be able to talk